Oh, you just caught me in some little bit of light reading. From as long as I could possibly remember, I think it was probably one of my earliest memories. I always wanted to start a video reading a book in an easy chair. So just finishing up a normal day's work, but I want to congratulate you on starting your family medicine clerkship. And I guess this video is really driven to address some of the issues. I think, for one, there just really is poor resources available in the transition from the preclinical curriculum to the clinical curriculum. And as best as medical schools can address that issue, I think it's really nice to get some real feedback and some real tips from students that have gone before you. So this is going to be a really short video, and it's hopefully going to give you some tips to really succeed in your family medicine clerkship. Do the best you can, get the most enjoyment out of it, and hopefully reduce any anxiety that you're having. Since this is a this is a study, I really want to emphasize that please don't share this video with anyone else, either in your clerkship or in your class, because that'll muddy our data a little bit. But please feel free to watch this video as many times as you want to get the most out of it and get the best experience possible for your clerkship. I think what's tough about family medicine is a lot of times, and really any of these clerkships is, not taking advantage of the clerkships or feeling like you could just skate through any particular clerkship. I'm pretty good at skating through a lot of things, and I think it's pretty natural, but it's nice to realize that family medicine really encompasses all of medicine. So no matter what specialty you're going into, you can find aspects of family medicine that are going to interest you and really refine the specialty that you ultimately you're going to be entering. So I hope you enjoyed the video, and if you have any feedback or thoughts, please feel free to contact me.
Hello guys, my name is Mitch Sadlowski. I am a current third-year medical student at Michigan State, and I know Dave wanted me to talk about how to succeed on a family medicine clerkship. I just think in general, to succeed on any clerkship, you really just need to put yourself out there and make sure you're being actively involved in the care of your patients. So when you're in the outpatient clinic with your family physician, if he has any procedures or he has anything that he's going to do, he or she's going to do, I just suggest that you ask if you can do that. After you get to know him or her for maybe the first week, just watch things, but then after that start advocating for yourself and asking, hey, can I do this PAP, or can I suture this person up? And more than likely your clinician's going to let you do those things. And it's really, you have to show interest and you have to put yourself out there and say, hey, I want to do these things. For the week in the residency clinic, it's going to be very similar to your outpatient experience with your private family physician. Same thing, just ask the residents. They're more than willing to let you do things. You just you have to show interest and show that you really want to learn. And then also, clinicians are busy, the residents are busy, so they might not think that you might want to do something as simple as suturing somebody up, but if you ask, more than likely you'll get to do it. And lastly, probably for the inpatient experience, I really suggest take ownership of your patients. You only get assigned a couple of patients on the inpatient unit, but know everything about them. Make sure when you're going in you have time as a student. Do a full physical exam. More than likely the patient's willing to let you do it. Then also, like I said, really take ownership, because especially at St. Mary's inpatient, you can enter orders in the computer. A lot of students don't know that. You can enter orders and then you have to have your resident co-sign those. So that's my suggestions, because I thought inpatient was more valuable when I started doing that, making sure I rounded on my patients on the PM, and then coordinating with a resident and asking a few orders, because you really do learn a lot. Because it's really easy to think that you want to prescribe a certain medication, but until you actually enter the orders and knowing what dose they're going to do, you never know.
Hi, my name is Elizabeth Black, and at the request of the wonderful David Henderson, I am going to share some tips with you that I think would make your family medicine clerkship really successful. The main thing is probably to just be really enthusiastic and go into it with an open mind. You are going to be spending a lot of time with the same physician and seeing what they do on a day-to-day basis. So this is their life's work. It's really important to be respectful of what they do, show enthusiasm, be kind to patients, all that kind of stuff that CHM students should be pretty great at already. I also think that this is also a great time to really build a relationship with somebody that could potentially write you letters of recommendation. You'll be spending so much time with this individual that they will really get to know you and your strengths and your weaknesses. So it probably doesn't hurt to try to really work hard and show the best aspects of your character and the great depth of knowledge that you possess.
I'm Lindy Babcock. I was a 2011 CHM grad. I'd just like to give you guys a couple more pointers on the family medicine rotation from my perspective, as I'm also a resident in the program right now. Because of the way family medicine rotation is broken up here in 3 distinct sections, and so I'll talk a little bit about each of those. My favorite month by far out of my 3rd year was my outpatient month I got to spend with an attending in family medicine. Granted, yeah, I really like family medicine, but I think it's something that can be useful to a lot of different people, especially if you've never been exposed to family medicine before. Some of the pointers for the outpatient rotation, I would say a lot of them use either NextGen or Epic as their EHR, their electronic medical record, and you have the opportunity to get access to that as a medical student, and I would really encourage you to get that access and to look into how the basic templates for charting office visits look, so that you can take the computer in the room with you and actually see a patient by yourself on your own or with your preceptor next to you, kind of running the visit. That was one of my best experiences. My preceptor would hand me his computer and say, "Here you go see this patient, come tell me what's going on," and we could talk about the plan. And that was really nice. It was a great experience for me. One of the things I would say is everyone has different interests, different things they're looking at, and within an outpatient office, there's a lot of different providers who have different niches. And so, if you're interested in looking at something specifically or seeing a certain patient complaint, I would recommend that you come in, 10-15 minutes early, so you can ask the MAs, the office staff, what the schedule looks like for the day, and you may be able to then kind of pick and choose the different things that seem interesting to you with different providers if your attending's willing to kind of share you with them. As far as the inpatient part goes, it's a 2-week process, as you know, and you spend that time on the resident service. And so the big things I would say for that are you really need to be visible. Very important that you are around and are eager to do the admissions and to see patients in the morning. The more willing you are to do things, the more you're going to get to do. I would also say that the patients that you're assigned to, that you're following, you have the opportunity, because of the way that we have a little bit of less time constraints in our service, you can actually have the opportunity to go and kind of follow the patient through different procedures, different ultrasounds, maybe go down to CAT scan with them, maybe go see their endoscopy. And that was a really good experience for me as well, just to kind of see, because I'd never seen, for instance, an EGD before. It was really nice to go down there. Most of the specialists are more than willing to have you there and to teach you while they're doing their procedure. The other thing is, when you're doing an admission with an intern, it'd be great if you offer to do the HMP, offer to write on the form and kind of fill out the information and synthesize things. And you should really kind of come up with your own assessment and plan as well, and that really helps solidify how to treat and how to manage the different conditions that the patients are coming in with. And that kind of helps you own the patient a little bit more and feel like you were much more involved than just listening to the intern doing the admission.
Hi, I'm Andrew. Got a few tips for you on your family medicine clerkship. First piece of advice would be to tell your preceptors what area of medicine is interesting to you. It can be pretty tempting, I think, to either say that you're interested in, for example, family medicine, or say that you don't know because you're worried about offending your preceptor, but I think being upfront is the best thing to do and can really help your preceptor get you the experiences that are going to be most interesting to you and really engage you. For example, I'm interested in pediatrics, and so I took advantage of this on my family medicine clerkship, and my preceptors helped to make sure that I was seeing pediatric patients, and that really helped to hone my exam and interview skills. Another tip that I would give you would be, whether it's in a busy clinic day or on the inpatient floors, to spend just 3 minutes between patients. looking at resources. For example, a lot of times I would just quick pull up Medscape or Dynamed or such resources, and this would really help me to develop both a really good, strong differential, but also help me to hone the practice of turning the evidence-based guidelines into specific actions and plans for patients, and will also help to both speak intelligently in teaching, as well as give a really good and informed presentation about your patient to your preceptors as well as your residents. Another thing I'd say would be, especially in the outpatient office, to always be courteous with and get to know some of the staff, like the nurses, the techs, the front office staff. They can be really great advocates for you to make sure that you're seeing patients, make sure that you get to see the patients before the preceptor, if that's what the preceptor wants, as well as be great resources for letting you know how things work, and also can have a lot of good information that they can teach you. Additionally, you can always help yourself or hurt yourself by being discourteous to staff members in the eyes of your preceptor.
Here's a screenshot from my iPhone of things that I've collected over the past couple of years that have been really beneficial. The Billy tool is a great resource for checking the patient's bilirubin level against their age. The AHRQ application gives the USPF TF guidelines for screening as well as treatments. I use for medications, I use a combination of the Micromedics and the Hippocrates. The Micromedics provides much better information as far as the mechanism of disease and background information. The Hippocrates, I think, is pretty nice for actual dosing. Shots is from the Society of Teachers of Family Medicine is a great resource for the immunization schedules, and it's neat because it stratifies it by the different patient populations. The pregnancy wheel and the BMI calculator are also within the MedCalc application. And then Dynamed is what I use for my point of care resource. It really is nicely laid out in that you can jump from diagnostic criteria right to treatment to epidemiology. So it's just a great resource for using, and it's a great thing to pull out and wow your preceptors with. The Infectious Disease Society of America has a great website that's mobile based that I just put a link to right on this page as well, and they have a lot of guidelines for infectious disease, which I think is a really hard thing to cover, and there really isn't a good other resource to use. And then MedCalc just has hundreds of different formulas to use, as well as just scales, so like everything from the Rankin score CHAD to the NIH stroke scale to gestational age calculator. So it's just overall a great resource.